Recording at all. Hi, welcome. You guys are in the right place. This is the workshop on getting local officials to endorse Medicare for all. And we're just going to give it a couple more minutes for more people to join the call. But while we're waiting, a couple housekeeping items. You are muted. And please, unless you're a speaker, keep yourself muted during the event. This workshop is being recorded and will be sent live on Facebook. So just for you to know that. And then please do go ahead and introduce yourself by putting your name in the chat, your name, city, your organization, and if you're a medical provider, your title. And then also, please do put any questions or topics you would like addressed into the chat as they come up. So welcome everyone, you're in the right place. It's a workshop on helping local governments endorse Medicare for all. And we're gonna just give it a couple more minutes and then get started. And Jamie, if you would just keep it, oh shoot. Okay, we will not be going live on Facebook, so there's an error. Okay, welcome everyone. I'm Sarah Wright with the Colorado Foundation for Universal Healthcare, and this is the workshop on helping local governments endorse Medicare for all. So we're glad you're here and you're in the right place. Please, a couple housekeeping items. We're gonna keep everyone muted unless you're a speaker, but this event will be recorded, and we do want you to go ahead and put into the chat your name, the city you're from, your organization, and if you're a medical provider, your title, as well as any questions or topics that you would like addressed as they come up. Okay, so once again, I'm Sarah Wright. Welcome. We're going to go ahead and get started. It's just a couple minutes afternoon and people are going to continue to join for a little while. So our mission at the Colorado Foundation for Universal Healthcare is guaranteed quality healthcare for all for life. And Jamie, you're going to keep admitting people, right? So I can let that go. Thanks. So we're a nonprofit and we work for universal healthcare system like Improved Medicare for All here in Colorado and the US. And the goal of this workshop is to give healthcare providers and activists the tools you need to pass resolutions in your communities for Improved Medicare for All. These resolutions show our Colorado legislators and the US Congress that we, the people in our communities, want single payer universal health care. In Colorado, legislation is in the works to get us there by 2024. So we hope you'll get more involved with the Colorado Foundation for Universal Health Care. And then we are also here to celebrate Denver City Council's passing 12-0, a Medicare for All proclamation. And before them, Fort Collins and the town of Jamestown, and more than 100, well, actually it is 109 US cities as of today. And we'll hear from the volunteers who did the work in Denver and Fort Collins, and they'll respond to your questions and provide the tools you need to get a proclamation passed in your community. And with that, I'm going to turn it over to our statewide coordinator for the Medicare for All resolutions, Rich Shannon. Welcome, Rich.
Hello, and thanks everyone for being here. I live in Fort Collins and have been an active and vocal advocate for Medicare for All for 15 years, and most of that volunteering with the Colorado Foundation for Universal Health Care. My work experience included 22 years in local government, 8 in Lakewood and 14 in Fort Collins. When this national effort to get local governments to pass resolutions supporting Medicare for all surfaced. I thought that's a great fit for me, and just decided to focus on that a lot. So that's where a lot of my volunteer time goes. And I'd ask, if you're thinking about trying to get a resolution passed in your community, consider me a resource for you, a coach to some extent, that's needed. My name, phone number, and email address is at the top of the chat. And at this point, I'd like to introduce Brittany Shanahan. Brittany is with Public Citizen and is the coordinator on a national level for getting these local government resolutions passed. Brittany, thanks so much for joining us today.
Thank you, Rich. So hi, everyone. My name is Brittany. I am the Medicare for All organizer at Public Citizen. The majority of my role revolves around working with activists around the country to pass resolutions in support of Medicare for All. So I just wanted to take a couple minutes to sort of give a little brief introduction into sort of like the national context of what we're doing. So the unique thing with Medicare for All as a cause is the target is specifically focused on Congress, on moving members of Congress. With other social movements, you get a broader opportunity to come up with creative ways to organize, because you're not trying to get your congressman to do things. And so everything is focused around pressuring reps in Congress. And if by now, most of the easy targets that you can get through small meetings of constituents, most of those easy targets have been acquired. And so there is need for more grassroots organizing, and it is historically hard to run a grassroots campaign based on a federal bill. So that's kind of where resolutions come in, is that's a great way to do this. It's a great way to make federal legislation relevant to people in your community. And also, a lot of people who need Medicare for All the most tend to be really disenchanted with Washington. And so your local government feels a lot more accessible to them than making a phone call or an email to a member of Congress. And so, like, the other thing is the city council members matter in local politics, for sure. And when you do go to these constituent meetings, if you bring with you a resolution from that person's district saying that you've passed a Medicare for All resolution, that city supports Medicare for All, it makes the case so much stronger. So I wanted to give just a quick couple of observations, sort of based on my history with this movement, with a kind of the focus of Colorado, that can help people get started. So as I said before, council members and mayors matter. So Robert Garcia recently got elected as a member of Congress, and he was the mayor of of Long Beach, California. So and he passed a resolution there. So the people you're working with now may go on to run for Congress later. The second point is that moderate local politicians can be convinced. You don't have to worry about them being super progressive. And then the third one is you don't have to choose as a target the town that you live in. Rich has done a lot of this work from Fort Collins, but as you can see, he doesn't, he's been able to work with folks in Denver and in Jamestown fine. So you can totally choose a target town in your area that you think is easier to pass a resolution, and then get started there. Thanks.
Great, Brittany. And I've just informed that my phone number and email didn't appear at the top of the chat, so I've entered that again. Brittany, thanks for the comments. Clearly, these resolutions are a big part of the grassroots effort to create significant social change around healthcare. Today, we're talking about towns, cities, and counties. But we want to emphasize, especially for the healthcare providers that are part of the group today, that resolutions from medical healthcare organizations are also a really critical part of this grassroots movement. We should also be thinking in the future about school boards. The voices of chambers of commerce supporting this would be huge. as was mentioned, these resolutions really can come anywhere and from any size community. Jamestown, Colorado, 250 was our leader with a resolution in 2020. Now, again, today's focus is on local government. So let's start with, I'm going to highlight 6 sort of basic steps that you'll likely go through, not always, but likely go through as you're pursuing a resolution. So if we can have those up, Jamie, just the getting started slides. There we go. The first one is kind of obvious. Build a team. 5 to 7 people is a nice, manageable number. It provides you a variety of skill sets, a diversity there, but also a diversity of networks within your community that may prove to be very helpful. Secondly, identify potential allies. If you're a healthcare provider, think about reaching out to known community activists. If you're a known community activist, think about reaching out to healthcare providers that you've found to be favorable to Medicare for All. Nonprofit organizations are a good source of allies. Finding a good handful of small business owners that are known and recognized in your community, that can be a very strong voice. Past elected officials, prominent community members. Make this more than just feeling like it's a small group with a Herculean effort. Third is look at the adopted city goals. It's very likely that you will find language there that you can use while working with your city council members to point out how they're not going to be successful as a community as long as our healthcare system stays in place the way it is. It creates too many roadblocks to too many things. There's also a possibility, and we can help you with this, the ability to identify how much money the city or county is likely to save under a Medicare for All model. We won't go into detail today on that, but if that captures your interest, we can help with that later. Fourth is anticipate meeting with city council members individually. If you know you're meeting with someone who's a strong advocate already, you can raise the topic of getting a resolution passed. But your first meetings may be more of just finding out what the situation is in your community. And if you're active already, you'll have some sense of how liberal or conservative the elected board is. But meeting with individuals and just starting by, how's the healthcare system working for you and your family? Secondly, what do they know about Medicare for All? Do they have any initial questions they have? And you'll know whether the idea of introducing this national resolutions movement is okay in the first meeting. But mostly you're gathering information so the team can decide, do we have a potential champion on the city council? And that's the 5th key point. The process goes much more smoothly if you can find a champion, but it's not critical. And sixth on our list here is we have a draft resolution for you. You don't have to start from scratch. The one used in Fort Collins and Denver can be modified very easily to work for your community, and you may want to start thinking about that. Now, I think right now, Jamie or Sarah is going to drop a link into the chat that gets you to Brittany's Public Citizen website. And there you'll find a really good toolbox. If some of your team members need to get a little more information themselves on Medicare for All, that's a great site. And there's some other tools that can be used there. Okay, Jamie, I think we're good, done with that slide. Thanks. So at this point, let's move in and hear from the folks who got things done in Denver. We're going to hear from Dr. Jason Rivera, Dr. Rick Beezer, and our city council champion, Chris Hines. Jason, please introduce yourself, your history with Medicare for All, and how you got us started in Denver.
Hey everyone, and thanks for that, Rich. I am Jason Rivera. I'm a second-year family medicine resident here in Denver. Very excited to be here and very thankful. So a little bit about myself. My advocacy started back in early medical school. I quickly realized when starting medical school, and this was out in Florida, that there was a lot of problems that could not be handled in the classroom with what we were being taught, because of course what we're being taught is very different from how we practice medicine. we practice medicine very much based on what the insurance companies will and will not allow us to do. And that's become incredibly difficult to reconcile with, especially as a new physician, knowing that this is the way my career is headed. So it's really spearheaded my efforts to, create the change that I wish to see. I also have a unique perspective as somebody who comes from a very impoverished background and have gone through the trials and tribulations of being a low socioeconomic status in America. So that in itself has brought up a ton of issues. And now that I'm on the other side of things, it's very easy for me to see how those issues bleed into everyday American lives and impact health way more than what I can manage to do to folks in the office. So a lot of my advocacy efforts have been directly attacking this, noticing that healthcare impacts everyone. This is not a partisan issue. This is something that is essential. And the longer we wait for this, the longer we'll have to accept adverse health outcomes amongst our peers. But I also know that this is an effort that's growing, and there's a lot of very interested and dedicated people out here, many of which are on this call today. So knowing that I was tapped into those local resources, I just, made a few connections here and there, and things fell into place really nicely for me to be introduced to Rich. And from there, Rich helped put a really nice team together in Denver, where we were able to brainstorm and go through those 6 steps that he just outlined, and get a resolution passed here in Denver, which we're very proud of. But we're also using it as momentum, as was previously discussed, for future efforts, mainly the 2024 efforts that we have here to create a statewide single payer program in Colorado. Thank you.
Wonderful. Thank you very much, Jason. And I'll tell you, as a community activist, to get a phone call from a doctor saying, hey, I really want to be in the lead, and obviously a really energized voice on this, energized me a lot. So my next step was to call Sarah, and this may be one of your first steps also. Sarah, who you met, who started the program for us, has access to a great network of names and email addresses of people who have expressed interest in this. She also has access to the healthcare professionals organization advocating for Medicare for all. So when I called Sarah, she quickly connected us with Dr. Les Reitman, Dr. Rick Beezer, Robin Mills, a nurse practitioner in Denver, and also Judy Danielson. Judy had a history of activism with an interfaith group. So we quickly found a really good team, heavily populated by healthcare professionals. So next, let's hear from Dr. Rick Beezer. Rick, you became the point person for us on this team. If you would please introduce yourself, your history with Medicare for All, and the role you played getting us going.
Hi, I'm Rick Beezer. I'm the co-chair of the Colorado chapter of Physicians for a National Health Program. I retired 5 years ago after 33 years as an emergency physician, which turns out is an excellent way of seeing the problems with the healthcare system we live in, not just for the underserved, but for the served as well. We all pay the price, both literally and figuratively, of the system we live in and work in. I was prolifically involved in an earlier version of the resolution campaign that kind of sputtered out at the beginning of the pandemic. But I was pleased when you all reached out to me again, and also pleased to find out that the first iteration had identified Councilman Chris Hines as a potential champion, because I knew I was in his district, and it seemed like I might be able to play a role in reaching out. And I've never done that before. It's not part of my regular routine to contact either on any governmental level representatives and ask them if they'd be interested in something like a proclamation or a resolution. Councilman Hines was extremely receptive, and I've told people since that I might have had a hard time talking him out of doing it, rather than it being a case of having to twist his arm and get him to do it. And he'll talk more about that later. So on the list of 6 that Rich had, the first one, build a team, is key, and realize that the team may be composed of people who have just dipped their toe in the water earlier. I went to a couple of public citizen webinars and learned some things and never followed through on them. I was involved in this earlier iteration of the resolution campaign that did not end in a resolution. And then so the way was prepared, the ground was plowed already by the time we got this going, and it was a very satisfying experience. And from my standpoint anyway, much easier than I had expected the effort to be. And I suspect that people who are watching this may have the same experience in their own community. So I encourage them to reach out and find like-minded people and take that step.
Thank you, Rick. Now we want to hear from our City Council champion, Chris Hines. Chris, please introduce yourself, your history with Medicare for All, the reaction you had when you got a call from Rick Beazer, and then walk us through the steps. What happened inside the hall of Denver City Council in order for you to get us to the finish line?
Great. My name is Chris Hines. I serve on Denver City Council representing District 10, which is basically the center city in Denver. I like to call it Denver's Perfect 10. Hopefully other people like to call it Denver's Perfect 10 too. But at any rate, how did I get involved with Medicare for All? I'm actually currently a Medicare recipient. I was a runner and soccer player growing up, but the week of the Democratic National Convention, which was here in Denver in 2008, August 26, 2008, I was in a crash, and it took my ability to walk. Because this is predominantly medical providers, I sustained a spinal cord injury. So my fracture is at T3, so I'm paralyzed from T3 down. Asia B, so I have some touch sensation, no motion, some vague temperature sensation. But that really got me engaged with the medical system. I didn't even have a primary care physician or any sort of provider before my crash, because I was on 3 soccer teams and I was a healthy young adult. But I certainly learned that the failings of the healthcare system. I went from not having a medical provider to 3 months later racking up more than $1 million in medical bills. So at that time, you may recall that was when Barack Obama was considering becoming president. Spoiler alert, he did become president. But at that time, the conversation was a valid one about lifetime maximums for insurance companies, and $1 million was the lifetime maximum for several insurance providers. I was lucky at the time in that my employer, not lucky that healthcare is tied to an employer, and that's another advantage of Medicare for All, but improved Medicare for All. But I was lucky because my employer switched providers between 2008 and 2009. So I had my crash. I spent 5 months in hospitals and recovering, and then went back to work. Another fortunate bit is that I have an undergrad in computer science and an MBA in finance, and I worked in finance for a software company. And so I was able to go back to work effectively the same way I was before my crash. But most people don't have that same luxury. But that's how I know about Medicare today. I'm also on Colorado Medicaid, and I'm very fortunate for that too. So because again, this is mostly providers, I'm on the Medicaid buy-in program for adults with disabilities. So I use a wheelchair today. I'm the first elected official in Denver's history who uses a wheelchair for mobility, local, state, or federal. I'm also the first elected official in Denver's history who identifies as a member of the disability community. So maybe other people had disabilities, but they didn't claim it. So, I mean, it's hard for me not to claim being a member of the community because it's, my physical disability and the wheelchair are very, obvious unless we're on Zoom. So trust me, I have a wheelchair below me. So let's talk a bit about the process. That's maybe more than you needed to know about me, but the process, I'll say, Denver City Council is a full-time job. We're the only full-time city council in the state that I know of, and we're also county commissioners. So that is a way for us to justify some of that, because we are the city and county of Denver, and the footprint of both are essentially the same. But not only do I make a living wage, I have funding for staff. And it is because I get an incredible amount of constituent outreach. I personally get about between 400 and 1,000 emails a day. And unless DSA is having an action, and sometimes I'll get more. But in the summer of 2020, in the protests, we would get a lot of email. And so I have to prioritize responses. And one easy way to do that is to prioritize constituents. So I don't know why I took my glasses off when I didn't have glasses when I was elected. So just 3 years ago, my first term of ever being in elected office started in July of 2019. But I mentioned one way to prioritize my responses is by prioritizing constituents. Well, fortunately, Dr. Beezer is a constituent. And he's also a medical provider. And so that piqued my interest. If you are a provider, you've gone through a lot of school and you've really dedicated yourself to the cause, to the industry. And by and large, medical providers are educated. Even if they're not engaged in the political process, they are educated and eloquent. The doctor was a constituent and had achieved a high bar of success in the education realm, helped me prioritize that conversation over or responding quicker than maybe with other conversations. I don't really often introduce proclamations, but I think this one's important. The reason why I don't do a lot of proclamations is just I want to make sure that my time is valuable and impactful, and I know that some of my colleagues really like to introduce proclamations for, say, city folks who have had a long career with Denver and retired. I don't really do that, but this is important for me. So another thing that another reason why I don't do a lot of proclamations is because it takes a lot of time to draft one. And unfortunately, Rick and his team already had one that had achieved a lot of success elsewhere in other city governments, and it made a whole lot of sense to me. The format, the flow made a lot of sense, and so this certainly this process has that institutional help or the assistance, and so that also was very helpful for me, saying, oh yes, let's do this proclamation over others. Another reason why I will take on proclamations is that many times our counterparts at the federal and state level, they'll ask for help or political cover, if whatever you want to call it, because they want to move forward a policy they feel is important, but it may not be politically easy to move forward. I mean, certain things are unanimous votes and are slam dunks, but that isn't always the case. And so I've been asked to do a couple proclamations for climate issues, because, as you know, the state of Colorado is a very much an oil and gas state. So I've sponsored a couple proclamations for our climate. our habitability on this planet. And this is another one where we've got a lot of resistance at the federal level because 3 of our Fortune 20 companies are healthcare companies, maybe more, but I think at least 3. And so with the influence in corporations, because corporations are people too, according to Citizens United, we have to make sure that we provide political cover for our state and federal counterparts. In this case, I just, again, speaking of the process, I talked with all of my colleagues before even introducing this proclamation officially. I wanted to make sure that that we removed the element of surprise, that we made sure that that colleagues were on board, and I'll be frank. Not everyone on city council felt that this was a priority, and that's fine. But and there were a couple bits of potential resistance, but we were able to talk about that in a safer space, amongst members in private, rather than introducing something in a forum where in a town hall or something like that, and or in a committee. But once we had ironed out all of the potential concerns with colleagues, then the next part of the official process was to introduce it into a committee. I happen to be a member of the committee, and so that helped. Our Finance and Governance Committee here in Denver City Council. But when we went to the committee, I presented the proclamation. I asked colleagues for their thoughts or comments. I also shared a bit of my story, and by the way, all of this, all of my work is the people's business and is owned by the people. And so, if you want to, you can watch these recordings, both the committee and the council meeting, and maybe I'll fish that up before the end of this and add it to the chat links for the committee and the council. But at the full body, we had multiple people sign up in support of Medicare for All in our public comment, and I want to thank people for doing that. I also want to thank them first for signing up for public comment and giving presentations, but also I want to thank honestly, I want to thank the organizers here for not spending a lot of time and effort emailing our council colleagues, because I already knew they were on board, and so it just would have taken time from providers or everyday folks, but it also would have taken time from my colleagues, and I knew they were already on board, and so it didn't really make any sense to then ask them to be more on board, because it's either a yes or no vote, and they were already at yes. We didn't need yes or whatever. So that was very kind of the organization to understand that sometimes part of the political process is speaking up, and sometimes it is not speaking up and making sure that the train gets to the station as smoothly and painlessly as possible. So I think that's a bit of the process. I'm happy to answer other questions and I think maybe there was already one in the chat, but I'll defer back to the facilitators to whatever questions you want me to answer. And there I am. That's me and in my wheelchair. There you go. And thank you again so much for all those who made this reality.
Great. Thank you, Chris, and thanks again for being our champion. As we mentioned earlier, please put questions in the chat, and we will be getting to those very shortly. We're going to move to Fort Collins, and there we had no trouble getting a team created, because we had for years had an informal network of Medicare for All providers that met on a regular basis, courtesy of the work of Elaine Branyard, who was our convener. and just made sure the group stayed together, kept networking. And we'll get back to that more later because it may be a tool you want to use in your community. But right now, I want to mention first that as in the Denver case, this was the second effort in Fort Collins. The first time we did not get a resolution, but we were able to get language placed in the city council's legislative policy agenda. For the first time, they included language about healthcare reform. It was very solid language. It simply didn't use the phrase Medicare for all. It was sort of half a loaf, but that'll be important as we move on to the process here. So I want to introduce Dr. Emily Galashote. She's a postdoctoral research scientist and a spectacular community advocate. So Emily, if you would introduce yourself and your history with Democratic Socialists of America and the Medicare for All movement.
Sure. Hi, everyone. So as Rich mentioned, I am a scientist in training in viral immunology, and I've been in Colorado for almost 4 years now. I'm a member of the Democratic Socialists of America, and there's a chapter here in Fort Collins. There's one in Denver, one in Boulder, a group in Colorado Springs. So we're a growing group in Colorado. DSA nationally has a movement for Medicare for all. It's one of their big priorities because we recognize, as everyone on this call knows, that our healthcare system really doesn't serve people. And so that's a big effort of the group. And so as a national organization, there's this movement to get Medicare for all resolutions passed at your city council, county commissioners, all of that. And I will put some links in the chat when I'm done talking. And part of doing that, you know, as everyone here knows, it's really important. It moves the public opinion. It can build momentum, builds knowledge and skills, which to get Medicare for all at a state level or a national level is going to be really important. It builds relationships. So as everyone's heard, it's really critical to have those relationships within your community and these different organizations. And it also kind of allows us to build our power as community members engaging with these elected officials. And so our DSA chapter in Fort Collins has been pretty involved with our city council for the last couple of years across all types of issues. So Medicare for all was one of those. And so before our most recent election for our municipal candidates back in April of 2021, as a chapter, we had provided them a questionnaire and then met with every city council member, or almost all of them. And in that questionnaire and in our talking with them, we explicitly asked, would you support a Medicare for all resolution at city council? So they were presented this question we had in writing. And of course, they all said they would. We got to talk with them about it before they were elected. So before we really brought this to council, we already had that relationship. They already knew this is something we were interested in. They already had said it's something they would support. So that was a big part of it. We also then, you know, as part of Medicare for all, but other things, had those sustained relationships with city council. So we would talk with them and they, I think, kind of valued us as a group and that relationship. So it wasn't a one-off thing, but they knew we were there and really invested in what they were doing. Rich, do you want me to keep going or do you want to talk a bit about the next step?
I just want to mention in the fact that we had this great feedback from council members that we were going to very likely get the vote, but we didn't have a champion. They had sort of reserved their political capital for other issues that they wanted to be lead on. So we instead took the approach of building a coalition. We wanted a diverse group approaching the council with this request. So it didn't look, again, just like a few of the local everyday advocates, so to speak. And here's who are some of the folks that were on that coalition. The head of the Mennonite Church, the head of the Unitarian Church, the executive director of the Colorado Cross Disabilities Coalition, an interfaith group working on immigration issues. We had 5 well-known small business owners. That's a really strong voice if you can get some business owners. A well-known advocate for early childhood education, an organized labor leader, and a state legislator who is also a champion of Medicare for all. So the broader, the better. We pulled that coalition together. And then Emily, why don't you wrap up by saying what you eventually put into a packet going to the council and what the final steps were.
Yeah, so it's fun to hear what happened with Chris in Denver and kind of similarities and differences. So we wanted to make this kind of as easy as possible for council to pass. And so we wanted to do as much work behind the scenes to just streamline it for them. So we, as this coalition, put together a packet, and I will share that packet for everyone so you can copy it and tweak it. It included a cover letter that really pulled all these different policy statements and legislative agenda and all the things that the city said they're committed to doing, and really tying that back into Medicare for All, so they can see how this fits within, the goals of the city. We had draft resolution language. So Rich had provided that, so it makes it incredibly easy for them to do. They don't have to reinvent the wheel. We had a list of all the cities at the time that had done it. Fort Collins likes to think it's a leader, so we can say, look, all these places have done it. We need to join this. We also had quotes from mayors and council members across the country that have done it. And so having that, hearing from other people saying, here's why this was so important to me as an elected leader to do this. We also had a letter from our state representative who represents Fort Collins saying how important it is to him. And so that was really important. So we had this packet, we provided it to them. We met with them individually before we came to council, so they all knew this was coming. Unlike at Denver, they really wanted, council members, made it clear they wanted to hear from the community and know that this isn't just a fringe thing. And they do not get 400, 1,000 emails a day. They're working on a different scale. So we used Action Network, which allows us to have kind of this landing page where individuals can really easily send an email to council. And so our city council received over 100 emails, which is quite a lot for Fort Collins, of all sorts of constituents saying how important this is to them and how much they want council to pass this. So they heard from community members, they knew we had a broad coalition. And then when it came time to actually passing it at city council, we didn't want to take up hours of their time with public comment because they had heard that, but we did have a few select individuals speak. So like Rich mentioned, we had healthcare providers, small business owner, labor leaders. You saw a picture of Kaori Kaiser, a DSA member. So again, and just a way to kind of get it in the public record on video, here are the people doing it. So that was our process. It ended up going very smoothly. Another thing that was great, and I will share the link, is we were able to get coverage in our local newspaper. So we had a good relationship with the woman who covered city politics. And so she wrote a really great piece basically outlining the process and everything we did. And for her as an outsider, it seemed like this really quick, easy thing. And of course, we knew it was months behind the scenes. And so she helped make that known to readers. So I'll share all those links in a minute in the chat, but that was our process, a little different than Denver, but ultimately achieved the same goal.
Great. Thank you so much, Emily. Sarah,
That's
at this
great.
time,
Yeah, so now it's time. Thanks everyone. Those were great, great insights. And now it's time for our volunteers and speakers to answer some of your questions. And there's just been a few in the chat, which I'll read. Speakers, if you want to take a question, go ahead and raise your Zoom hand, and then Jamie will know to spotlight you so you can answer. So I'm going to go back to Jonathan Ward. And before, I want to mention that we had somebody on the call from Maine All Care who's going to get the recording and is really excited to take this up in Maine. I just want to mention that because she had to scoot off. She had a conflict come up. So from Jonathan Ward, who is a retired cardiologist and a member of Medical Professionals for Universal Healthcare. He has two questions. The first is about Boulder. So like Fort Collins' first effort, we in Boulder had a really amazing petition signed by many medical providers, and Boulder City Council added language to their legislative policy agenda. But they've told us they have stopped doing resolutions. And so we're disappointed, and Jonathan is wondering whether we should continue basically and what we could do next. That's the specific question. And then in general, how do we approach progressive hospital system or medical societies, Colorado Medical Society, any of those that have a policy not to engage in political issues? So I'm hoping that some of these speakers might have raised your hand to take those questions. Oh, I see two, Rich and Brittany.
Let's have Brittany go first. She's got broader background.
Okay, great. Thanks. So I can answer the first question about Boulder, which I think I can't remember. Someone can say in the chat if it may be the case that they came up with this new policy around the time serendipitously that people were asking them to pass a resolution. My answer for this is to find another target. And to not think if you live in Boulder and your city council say is throwing you this sort of, I call it a banana peel. It's like if you've ever played Mario Kart racing, you throw banana peels to like make your friends like lose traction so you can speed past them. And in most cases, banana peels, like you can maybe wait and come back. And in some cases, you can keep doing it, but the point of people saying this is them saying, I don't want to do the work behind this. And in that case, I would say, look at some of the large suburbs around Boulder, look at the county, find another target. Don't worry if you don't live there, because you can find people eventually who live there who can go to constituent meetings. I think the Colorado organizing has done a really good job at figuring some of this out. But I mean, if they give you a hard no, you can come back later, but I wouldn't take it as like a reason to just give up.
Thank you, Brittany. And then the second part was of Jonathan's question was.
Excuse me, Sarah, do you want to let Chris answer that one too? He's got his hand up.
Oh, yeah, absolutely.
Some good insight on when a council says no.
Yeah, thanks. Thanks for the opportunity. And I guess it looked almost as if the question was specifically directed for me anyway. So I'll give you two answers. One was kind of already covered. If Boulder City Council is being reticent to address the particular topic, you could go to Boulder County Commission. Those are two separate bodies. So it's only Broomfield and Denver where the city and county are the same. So, but that's an opportunity to still get support from Boulder. And I don't know what the context is behind why they're reticent. I mean, Boulder is generally a more liberal city and county than Denver. Denver's on the more liberal end, but Boulder is more liberal than Denver in general. The other thing that I wanted to mention is we passed here in the city of Denver legislation about recycling, composting, and trash, and that was commonly referred to pay as you throw, and that was a long conversation. I know that I was hearing about pay as you throw before even being a political candidate, and it was just passed in June of this year. And I announced my candidacy in May of 2018. So long conversation. And EcoCycle, which is also based in Boulder, by the way, they made it a point to come to public comment, and they would have one person in public comment consistently. We would have public comment every week, and that would be one person talking about pay as you throw each week. For quite some time. And so that is another opportunity to kind of socialize the topic and the proclamation. And as Fort Collins had mentioned, and Emily, that it helped people realize that it wasn't just a fringe conversation. It was something that had a broad level of support. So, try Boulder County Commission and also try public comment, and just to help socialize the topic. Thanks.
Okay, so the second part of Jonathan's question had to do with there's bodies like the Colorado Medical Society that it would be really powerful if they passed a proclamation, but they have a policy to not get political. Does anyone want to take that? Is that why your hand was up, Rich, or is it just still up from before?
Just from before.
Okay. Okay, well, my thought might be to address them with the moral injury aspect, because that is such an issue for providers. Many of the young doctors I have talked with have literally almost quit their training because of moral injury, just being horrified with the system. So I don't know. I'm not a provider, but that's what I would suggest. Then there's a question from Ingrid Moore from, I believe it's Longmont. When discussing this with city officials, did anyone quantify the cost to the municipality that this would alleviate? And are those figures available? I'm guessing that you want to take that, Rich.
Yes. There are pros and cons of wading into the financial aspect of it. In some cities that are conservative, but you see a potential opening, this could be a very good tool. We have a template we've used before. We provide the template, and we, with permission from the city manager or county manager, work with one of the key staff members that helps fill in the numbers. And it identifies what the savings could be against a hypothetical Medicare for all model in which the employer is paying 5% of payroll. And that's a pretty good number based on all the various studies and projections for how Medicare for all would be paid. A big chunk of the income is a payroll deduction, and this 5% is a pretty good target for cities or counties for all employers. So if you think that would be of value in your community, we can help you get those numbers from the city. On the other hand, value statements tend to be more important than factual statements. I mean by that, I mean trying to overload them with facts and figures. So short answer is we can help you with that.
Thanks, Rich. And then Dr. Les Reitman, another medical professional for Universal Healthcare, asks, are there non-governmental bodies that can issue these proclamations even though they were not elected? So I'm wondering if that's a question for Brittany. Have you seen any I don't know, other clubs or organizations? It looks like Rich's hand is up, so.
Yeah, I can speak to it quick and then let Rich go for it. Yes, unions can do this, and church bodies can do this as well. And those are two really powerful groups. I make a joke a lot that like the ideal person to bring into a constituent meeting with your member of Congress is like a union organizing nun. So I mean, like there's other places you can approach for sure.
Okay, thank you. And then there are some interesting comments on the chat people might want to check out. And we had a question following my statement about moral injury, where Carol Pranchi, I'm sorry, I don't know how to pronounce your last name, Carol, asks, what is moral injury? And I wondered if one of the speakers, or maybe Dr. Maddie Jacobs, who's on the call now, just want to answer that quickly. We are sort of running short on time, but that's a really important question.
I'm happy to answer it. This is Madeline Jacobs. I had major technical issues, so I missed the vast majority of this, and I'm sorry if I have any repetitions. Moral injury is basically when you know what needs to be done and you're not allowed to do it, and that is what healthcare professionals are dealing with in this healthcare system. And the way that the corporate entities, they call it, quote, burnout, unquote, which means you poor little things are working too hard and you need aromatherapy. And that is not what it is. It's actually being forced to violate our Hippocratic oath, which all physicians have taken. and not being allowed to do what we feel we need to do. And that is the reason why many healthcare providers, not just physicians, but across the board, nurses, radiology techs, physical therapists, the entire gamut are leaving healthcare. And so that is something that we're working on as medical professionals for in our career.
Thank you, Maddie. And that's actually a really good segue. Jamie, if you would share the different actions for the Colorado Foundation for Universal Healthcare, that would be really great. It includes how to join medical professionals for universal healthcare, as well as we do have monthly Grow the Grassroots meetings as well. Medical professionals for universal healthcare meets twice a month, and that group is incredibly effective and really active. So, and we had a video that I will send a link to in the follow-up materials from Robin Mills, one of the providers who was involved with Denver, talking about how basically being involved in this effort helps her feel better and decreases her sense of moral injury. Not that it's any better to practice in the system, but just because she's taking action to do something about it. So we invite you to join that. And then just these resolutions are part of our strategy for winning universal healthcare in the US and Colorado. And they show that people are hurting and that we want our elected officials to act to change healthcare for the better. And in Colorado, 2 recent surveys show this. Jen Phillips of Durango League of Women Voters of La Plata County was on this call. I hope she still is and can just wave. But they just did a survey over 7 months of 56,000 people there in La Plata County. And the majority of respondents agreed that the current healthcare system is in need of reform and that government intervention is necessary. And 77% of all of La Plata County agreed that a universal healthcare system should be established. And another larger survey done by the Robert Wood Johnson organization earlier this year showed that most Coloradans want big change from the government on healthcare. So we can do this. And I'm going to ask you to stop sharing the screen for a minute, Jamie, and then you can raise your Zoom hand, but if there's anyone that is on the call that feels inspired and is interested in doing this in your community, would love to have you raise your Zoom hand. I think we have all your emails from the various registrations. We'd be glad to have a follow-up meeting with you. Anything to get you to sort of take the next step. So wondering if there's anyone out there who's at least willing to have Rich reach out to them in your community or have another follow-up meeting. Great, Carol, you're muted. So I put my contact information. Hi, Carol. Are you in Longmont too? Is that what I saw?
Yes, I'm a resident of Longmont. Yeah.
Okay, and so is Ingrid. So that's already the beginning of a group with the 2 of you. So that's awesome. You saw in the chat and on the slides, Rich's contact information and mine. I'll put it in again.
Yes.
We want to make sure we can follow up with you. And yeah, I would be happy to work with Jonathan Ward and Boulder for the Boulder County Commissioners, as I bet some of the other people would. So that's another team. And it was nice to get that clarity from you, Brittany, because I think part of us wanted to just keep banging our fists on the glass around Boulder City Council, but the commissioners is a really good idea, at least for the time being. Anyone else who's on the call who feels inspired, at least to take the next step? Those are 2 different communities and we're glad to get that started. All right, well, please do consider it, even if you're Zoom shy. It's really nice to have, as Elaine can testify, to have a group of people in your community, all different organizations working together on this shared goal. So we hope you'll consider it. And then I just have one more slide. It's the Colorado Gives slide, because the Colorado Foundation for Universal Healthcare is involved with many stakeholders and partners on a two-step process to get us to universal healthcare for Colorado by 2024. And we are so excited. We want you to volunteer. We want you to participate. These resolutions, like I said, build the momentum. They show the need and the will of the people. And so we hope that you will get more involved. And Colorado Gives Day is just around the corner. And that is a local power response to the consumerism of the holidays, to invest in our Colorado communities and make Colorado a better place for all Coloradans. And so we hope that you will consider the Colorado Foundation for Universal Healthcare for Colorado Gives Day. And you can schedule those donations anytime now through Colorado Gives Day, which is December the 6th. Thanks for sharing that slide, Jamie. And you just go to coloradogives.org and you can look us up, Colorado Foundation for Universal Healthcare. So I really want to let you guys know that it means a lot that you are all here today. And thank you to the people in Fort Collins and Denver. And Bill Semple, our board chair, was instrumental in Fort Collins passing a resolution. So thank you, Brittany, for the work of Public Citizen and also DSA nationally to get these passed all over the country. With these actions, including resolutions passing in cities across the country, we show the popular will for improved Medicare for all. And that in turn will help us get Colorado to universal healthcare by 2024. Thank you. Thank you so much.
Thank you all.
There was a lot of, oh, thank you. Chris says he knows 2 of the 3 Boulder County commissioners and would be happy to chat with them. Yes, I'm just going to say yes. And
No.
we have several other comments in the chat. That wraps up our official program. Laura Hybert of Grand Junction said that you guys talked about Grand Junction, and so maybe it'll be time to look at that again in the new year. Great, wonderful. And then there was some discussion about Oregon, which I think we'll probably not try to tackle in this call because we're at our hour and we know it's Saturday and your time is valuable, but hopefully we could address that in another call. So is everybody good, or are there any burning questions?
Sarah, I don't want to have a question, but I just want to thank Chris Hines for what he just offered to do.
Yes.
That could really be huge. When you get a Denver City Council member calling some of these other city councils where they have a personal relationship already, you're halfway to getting a champion. Thanks, Chris.
Awesome. Thank you so much for your time, everybody. Enjoy the rest of your Saturday. We appreciate you. Bye.